Everyone, thank you so much for your service to our country. Thank you for being here today. Dr. Fauci, on April 13th, Fox News host Tucker Carlson talked about the effectiveness of vaccines on his primetime show, and he said, quote, "Maybe it doesn't work, and they're not telling you that," close quote. On April 14th, yesterday, during the day on CNN, you called Carlson's statements, quote unquote, a crazy conspiracy theory. Last night, Mr. Carlson responded to you, saying it's not a conspiracy theory. He said, referring to vaccines, quote, "If this stuff works, why can't you live like it works? Why are you wearing a mask?" Well, what's the answer, Dr. Fauci?
The vaccine trials that were done that showed the high degree, 94, 95% efficacy, the primary endpoint of the vaccine efficacy was to prevent clinically relevant disease, clinically recognizable disease. What we don't know right now, but we will know as we gather more information, that you can get infected even though you've been vaccinated, and because you're vaccinated, have no symptoms. And therefore, you could have virus in your nasopharynx, and you could then transmit it inadvertently to somebody else. You're vaccinated, you're protected, you're not getting sick. So the wearing of the mask is predominantly to prevent you inadvertently infecting someone else, even though you're protected from disease by the vaccine. As we learn more and more, which we will, and the evidence gets better and better, that a vaccinated person has a much lesser chance of getting infected asymptomatically. And even if they do, the virus is very likely very low in the nasopharynx. When those data become clear, the CDC, being a science-based organization, will use that scientific data to say, now a vaccinated person can actually walk around without a mask. There's another issue also, one other thing, sir, let me say, that's important, is that there are variants that are circulating too. And we want to make sure that if you have full protection against one type of a virus, that a variant might come along that might escape the protection. So if you want full protection and you're out in the community where there's a lot of virus out there, that's why we still recommend wearing a mask. And in answer to question before, when you get the level of virus really low, all of that's going to go away, and you're not going to have any very, very little risk. Therefore, people will not have to wear masks.
Got it. Let me show you this chart, Dr. Fauci. It's of the United States. It's a map created by the CDC. Basically, what it does is it shows the highest incidence of COVID since the start of the pandemic. The darkest blue is where COVID rates were the highest per 100,000 residents. There are 4 in the middle of the country: North Dakota, South Dakota, Utah, and Tennessee. I want to direct your attention to South Dakota for one moment. The governor of that state is a woman named Kristi Noem. Governor Noem said the following: "We never instituted a shelter-in-place order. We never mandated that people wear masks. We never defined what an essential business is." That's what she said at something called CPAC, the Conservative Political Action Conference in February. And in fact, she invoked you during that speech, and she said, "I don't know if you agree with me, but Dr. Fauci is wrong a lot." And then you responded saying, "The numbers in South Dakota, quote unquote, don't lie." What did you mean by that?
Well, at the same time that the governor was saying that, if you look at the number of hospitalizations and deaths per population, South Dakota is way up there in that particular category. So I don't think that's a good track record.
Administration of COVID-19, correct?
Excuse me?
That is not a successful handling of COVID-19, correct?
If you're using hospitalizations and deaths as a parameter, that's not very successful.
Dr. Walensky, there was something called the Sturgis Motorcycle Rally in South Dakota. 460,000 people showed up. No one was wearing masks. In a CDC study, in a Morbidity and Mortality Weekly report, it was found that 34% of counties in Minnesota experienced COVID-19 cases related to the Sturgis rally. Dr. Walensky, is it fair to say that what happened in South Dakota with regard to not adopting restrictive measures on COVID-19 caused deaths in Minnesota?
We were very worried when people came to that rally that they would get infected and bring it home. So I can't tell you the individuals, but that was the deep concern at the time.
And you can't rule out deaths in Minnesota related to the Sturgis rally?
No.
Thank you.